So, welcome to our second discussion in our series about healing healthcare. Sheena Williams and I are here, and we're very excited today about our two guests who we're lucky enough to have join us. We have Nisha Mehta and we have Monique Dowdy, and Sheena is going to introduce them further, and we're going to get into the discussion. And I hope for everybody who's watching this, I hope they're healthcare workers or you aspiring to be in the healthcare industry. I hope you are inspired by this conversation and find it useful. So Sheena, take it away.
All right. Hi, guys. Hope everybody's doing great today. Today, we're talking about wellness and healthcare and how we can better take care of ourselves. So first, we have Dr. Nisha Mehta. She is a radiologist and keynote speaker, writer, and physician advocate who focuses on helping doctors see the big picture as far as financial literacy, taking care of themselves mentally and physically, and creating longevity in their field. So let's start with you. What do you think about wellness today, how we can do better with it, how physicians can do better with it? What is your take on it?
Yeah, I think wellness has exploded as a topic over the past decade, not just in medicine, but certainly everywhere. I think there's been a lot of talk about wellness in medicine over the last decade as burnout numbers have increased. So now there's statistics showing that nearly 50% of people in the healthcare field will express some form of burnout or sentiment of burnout. And I think that the big overarching thing for me there has been, I first got into it talking a lot just about taking care of yourself and taking care of, making sure that you understood that you were a person too and not just a physician. But I think that that's expanded a lot. And now I really view wellness as this much more comprehensive thing where you've got to have all of your, all the different aspects of your life kind of coming together in the balance that works for you. So whether that's financial literacy, business literacy, personal well-being, making sure that you're taking care of yourself physically, mentally, emotionally, all of those things come together to really impact your ability to be able to do this, which, it's just such a taxing, stressful field in so many different levels. And to be able to do it for 10, 20, 30 years, you got to keep that big picture in mind, because otherwise, I know so many physicians who will just work, and kind of keep their nose to the ground for a while. And then 5 or 6 years later, they've had it and then they leave medicine, and that's obviously not doing anybody any favors. So a big focus of my work is really how do we create that career longevity in medicine such that you can do it for the long run, because we need our healthcare providers.
Yes, I would agree. We definitely need you. All right. So then we have Nurse Monique Dowdy. She's representing for Philly and she's representing for the nurses. She is a neurosurgical critical care nurse. She's been a nurse for 8 years. She's also done some traveling. And now she focuses on being a wellness coach and teaching women of color how to practice self-love, how to practice self-care, and take care of themselves to the fullest. So tell me, Mo, I know you have IamNurseMo.com, and I know you have all these different ways that you help out other nurses, but tell me also, how would you define wellness?
So first of all, Nisha hit it right on the head, but I would also define wellness as just feeling good overall and also allowing yourself to not feel good too, and loving both sides of yourself. So there's the side of yourself, I like to describe it as we have two sides of ourselves. We have the easy side of ourselves to love, and then we have the hard side of ourselves to love. I like to call her summer girl and winter girl. Summer girl is working all the time and she's getting to the check and she's helping people, and winter girl is a little bit low. And, she may want to sit on the couch and watch Netflix and chill and eat a pizza and just stay in her pajamas all day. And it's finding compassion for both sides of ourselves. So I think that in healthcare, a lot of us are starting to get burnt out or lack empathy in those areas. And we've all worked with that nurse that you like, oh, she need to retire. Or that doctor that, isn't able to express compassion. In the work that I do, I like to see everyone as a reflection of ourselves. So if we can't find that compassion and that empathy for ourselves, how can we find that for others? So that's really the work that I do around this, and I absolutely love it. And mainly, I wanted to start doing this self-love and self-worth work, especially for healthcare providers of color, because we're often given a package in healthcare. We have a very different field where we're told, okay, this is what you have to work. These are the shifts you have to work. These are the hours you have to work, and this is the pay that is available to you. And we become accepting of that instead of saying, okay, well, what kind of career do I want to have? What works for my children? What works for my overall well-being? So I really wanted to do the work that I do around wellness to show healthcare providers that your career can work for you instead of you working for your career. So thank you for having me.
So I think that, I know for me, I see nurses and doctors all the time. And once we get to that point of burnout, mistakes happen, unfortunately. You know, as nurses, we have alarm fatigue, and like, if it ain't beeping loud enough, we may not hear it because you get overwhelmed with the constantness, even though that's not a word, I made it a word, you know, of the alarms, all the fatigue that comes with it. I don't know necessarily always what the answer is to that, but I think like Nurse Mo and Nisha, you hit it on the head as far as understanding that there's a bigger picture. You do not, just because your goal was to be a nurse or to be a doctor, to be an NP, to do your fellowship, it doesn't mean that your career has to be limited there, and you can absolutely set up your future for bigger things. So Nisha, tell me how, I know you have your online communities where you have hundreds of, I think you said thousands of doctors that you created a database for. So tell me about that.
I was on faculty in academics. I had grant funding. I was doing kind of all the things that I was supposed to do, right? I'd gone through this very like academic training where I was at Brown, then Penn, then NYU, and I just kind of had this mold that I was following, and then I took this academic position on faculty. And my husband was the same way. My husband's a plastic surgeon, but he had done general surgery residency followed by plastics fellowship, and we were both just kind of doing all the things we were supposed to do. And I think at some point along the way, we had 2 children and we were just doing all the things, and we stopped, and we were going to take these jobs in the Northeast that would have been more of the same. But we were tired by the end of training. And, I had been an attending for 2 years by the time he had 9 years of post-med school training. And by the time we got to the end of that pathway, he was really saying like, okay, we were just looking at each other kind of being like, is this what we signed up for? Like when we fell in love in college, was this the life that we were trying to create? And if not, like, what are we doing wrong? So we took some steps back. He took a very different job in Charlotte. And I kind of was left with this 6-month period between when I found a new job that kind of fit my new priorities, and got credentialed and did all those things, where I started writing a little bit just about all the things that I saw wrong with medicine and the culture of medicine and what wasn't sustainable with new demographics in medicine, right? Like nowadays, more than 50% of enrolled medical students are female. And a lot of medicine, in terms of the culture of medicine and jobs and the way that things are structured and hierarchies and lack of flexibility, is just very, very difficult for females who are trying to find their way along that pathway. And so what you see is actually, it's really scary because 40% of female physicians within 5 years of finishing training will either cut back significantly or actually leave medicine entirely because they just find that like it's not compatible, right? And I'm seeing that all around me and all of my friends that I trained with and that I went to medical school with, and people are, cutting back or burning out, and we're relatively early on in this career that we spent 30 years trying to get to, right? And then you're looking at it from a policy perspective, and I do a lot of health policy stuff. And so I'm freaking out a little bit because I'm thinking, we already had a doctor shortage well before all of this burnout stuff really started being exacerbated with all the changes in the healthcare landscape recently. And now you're looking at 50% of females coming out, 50% of our physician workforce being female, and 40% of them saying that they can't function within that environment. Like, we've got to change something. So I started writing a lot about that, and somewhere along that pathway, I created a community of physicians just to be able to talk about some of these things with. It was never supposed to be a big thing. It was less than 10 people when I started it. It was really just a place for me to share some of the thoughts or share some of my writing. And that community has now grown to over 110,000 physicians, which, if you look at the healthcare, we've got less than 1 million physicians in the country. So there's a good percentage of us that are on this group kind of talking every day about the challenges in the healthcare landscape and what we can do to make things different, and how do we create the lives in medicine that we want, right? Whether that is by pivoting a little bit, changing gears, adding different aspects to our careers, doing passion projects, whatever it is that takes us to get that career longevity such that we can do it for a long time. So that's really become my passion now, is really encouraging people to think outside that box a little bit about what it means to be a doctor, and what does that, are we doing anybody any good if we're all burning out 5-10 years down the line?
Right. I wonder what, I guess the obvious question is, I wonder what healthcare administrations can do to assist in this process. Because I know for me, just me for example, I'm working, I take care of my son all day. So there's times at night, I work night shift, where I wish that there would be some type of, oh, you know what? We know that y'all ain't got no school. We know that y'all raising kids all day. How about we have a nurse that circulates to make sure everybody gets a nap? Yeah. Because at this point, it's a fact. At this point, it's a fact. You don't need me to tell you that these kids aren't in school. You know that we have to be active with the children because they have to literally clock in at 8 a.m. and clock out for virtual school. It's a process. The parents have to be right there next to them to ensure that they succeed. And it's not a few hours, it's all day. So we have nurses that are literally getting 20 minutes here and there on the couch while their kid is sitting right there on virtual learning, trying to keep up. And we're also relearning everything ourselves to be able to teach them, and then going to work at night. So yes. if you worked 3 shifts in a row, you now have been up for how many hours? And then you expect me to walk into an ICU and be able to titrate a drip safely. and exactly. And at that point, is that safe? And is it beneficial? Because I feel like it's always about budget, but you got to look at, is it worth the lawsuit if something goes wrong? So yes. I just feel like, as healthcare administrators, if you guys are watching, because we know you guys sometimes are nurses and doctors too, we're looking at also that, like, what is it that healthcare administration can do to help us? Because I could tell you, like, when I hear about sometimes, I'm a Philly nurse, but when I hear sometimes about LA and how they treat their nurses and how they give them scheduled hourly breaks where they actually can leave the unit, when they do things like that, that kind of thing is very attractive to me, because I feel like my break is my break. Y'all don't pay me for my break. So let me go ahead and head out and do what I got to do. So I can, it's about safety. It's not just about, oh, you can't sleep at work. No, we work night shift. It is extremely hard to stay awake for 13 hours overnight and be alert and awake and not ever touch your phone or distract yourself, or it's a lot of work. So I just feel like, tell me, you guys, what do you think? Mo, I see you itching. Go ahead, girl. Go ahead.
So I absolutely love this, that you're bringing this up. I'm going to shout out a hospital that I worked as a travel nurse. I worked at over 11 institutions in the country over the last 5 years. And it has been really, really interesting in seeing the different dynamics on how different institutions treat their nurses and their physicians. And when I worked at UCSF, which is an amazing institution, highly recommended, I worked in their neurosurgical critical care. I got a 30-minute break to eat lunch and an hour to take a nap at night. And I never left my job feeling tired. I was like getting off work, going surfing, getting off work, doing yoga in the morning. It was really, really a healthy lifestyle for me. And I was actually able to fully build my business during that time because I was like really empowered. So I think the number one way to change this is that, this goes to the element around self-love and self-worth, which is huge because we are just accepting what we're given and saying this sucks. But in California, a lot of nurses are speaking up in the sense that this is not okay for us. So the more that we, as the providers, as the nurses, accept, I'm just going to eat my lunch in the closet real quick, I'm just going to keep my phone with me, the more that our administration understands that this is okay for us. We send a broadcast out to other people, whether it be at work or play, on teaching them how to treat us every single day, whether it's in healthcare or not. Healthcare is not immune to this. So the more and more we accept these bad assignments, these, oh, can you just come in, and it's your day off, or calling me at 1 p.m. and I work night shift, which is an ungodly hour, instead of just not answering your phone and setting those clear boundaries that this is not okay, getting the staff together and saying, why are we working rotating shifts, right? When you want to work night shift and I want to work day shift. So I think it's an element of empowerment and knowing your worth as a provider and saying, hey, this does not work for me. And I know it doesn't work for you either. So let's get together and bring this to administration. But we have a lot of people that are like, oh, this is okay for me. I need this job. And
yes,
they need you. They need you. So that's the thing. that I think is an issue. And I don't think that it's an easy fix, but I do think it takes unity amongst healthcare providers to sit down and say, this is not okay, whether you're billing for your hours or not, as a nurse, because it just, when I worked in the ICU, it was ridiculous things that went on. I was a travel nurse, so we're kind of like the bottom of the barrel. Like, we have to take what we're given. And I remember I was given a schedule where I had to work Monday and Tuesday night shift, and then on Thursday day shift. So I went to my manager and I was like, hey, why are we doing this? There's enough people that want to work night shift. Let's switch this around. Like, can we talk to the whole floor and find out if we can do block scheduling? Because there's no reason we should do this. And we ended up getting block scheduling on the unit just because one person spoke up. But the more and more we accept what's available to us, the more they'll continue to abuse us. So we can't expect, this is gonna sound crazy, but we can't expect our oppressor to fix the issue for us. We need to come to them with a solution. That was heavy. Sorry for coming like that.
No,
it's
completely legit.
I think that, it's true, because listen, it does take the nurses and the physicians on the floor to speak up, or hopefully the physicians advocate for the nurses, right? We need that to happen too, yes, because they don't do the work that you do. So they can't possibly have the perspective that you have. So if you're asking or waiting for the administrators to sort of step up and know what you need, they can't possibly know, because they just don't have that view. So it is critical for the people doing the work to actually step up, advocate for yourself, and dictate to them really what you need to be at your best performance-wise. And what's coming to mind listening to all of you is, what's incredible is, one of the biggest components you need as a healthcare provider, I think, is empathy, right? And that well of empathy cannot run dry, because the care will suffer. And so if you're moving through your shift and nobody cares about you, and you feel that nobody cares about you, how do you then draw from your well of empathy and care for others? You're not being fed empathy. So it's almost impossible for you to have a well of empathy. In order for you to keep your well of empathy full, you need someone to fill it for you. You need love. You need someone to look out for you. You need to know that people are caring for you. So if there are any administrators listening, I think that critical piece to fill the empathy well for our healthcare providers, because it does run dry. And so you're then left to fill that well for yourself with self-care, with whatever methods you find relief. But I just think that's an important piece.
Yeah. I mean, I think what you're saying is just and I do a lot of consulting for healthcare systems where they're like, okay, what can we actually do about this? Because they're getting to the point, right, where this is costing them dollars, right? They're getting lawsuits because careless mistakes are made. They're getting people turning over. Physician turnover is really expensive. I imagine nurse turnover is the same. I don't know the statistics for it as well as you may. But physician turnover is very, very expensive for systems. And then obviously, if patient rating, satisfaction scores go down, all of those things negatively impact systems. And so what we're starting to see is, I have more and more systems that are contacting me saying, what is it that we can do to actually effectively move the needle on this problem? Because it is costing us money. We do want to do something about it. And it's really important, like all of you guys have alluded to, it's really, the whole you can't pour for an empty cup thing is legit, right? Like, you cannot ask people to just show up and soldier on every day without giving them something to hold on to, or giving them the good faith that somebody's looking out for them too. And I think so many of those issues, if you look back on like just how COVID evolved and how many of these issues have really come to a breaking point over the last few months, because physicians and healthcare, other healthcare professionals have not felt taken care of because we can't get you PPE, right? I mean, if we can't get you personal protective equipment and we're going to ask you to go into these rooms with COVID patients and potentially expose yourself, your family, right? The number of physicians that I know that are living in RVs right now because they feel as though they are a danger to their families. So they're literally living in their driveways and RVs and not going near their children, right? And so what happens is in the heart of all of this, right? I remember in March and April, we had all these physicians in New York that were just at the end because they were coming out and they were saying, we just saw the most horrible stuff. You know, we've intubated more patients than we've ever intubated. We've seen multiple people in the same family die overnight. You know, we've seen multiple people have to say goodbye to their loved ones over FaceTime because there was no way for them to be able to come and say goodbye in person. So they died alone, right? All of these things, you go to work, you see all those things, and then you come home and you've got nobody to go to because you cannot give your family member a hug. You can, you know, as I remember, this male physician called me after a really bad shift and was just like, literally all I need is a hug from my wife and I cannot have it right now, right? And it was just so heartbreaking because how do you do that day in and day out? I mean, I think we're all in this mode where we know we just have to get the work done and we get it done while we're there. But then when we come back home, we need to be able to unload that. We need to be able to deal with all of that stress so that we're recharged to be able to go back the next day and do it again. And I think that, you know, one of the things that I always tell administrators is I understand that a lot of these decisions are made based on what's the most cost effective or the bottom line in terms of numbers, but it's very short-sighted to look at it that way because that will only get you sustainability for so long. And at some point, if you have enough people quit or enough people just kind of give up because you can't like keep them happy and refreshed and loving what they do and caring about what they do, then it may not be tomorrow. Your numbers may look great tomorrow, but a year from now, 2 years from now, 3 years from now, who are you going to get to work at your hospital system if the word out there is that you don't take care of your employees? And if you start furloughing them or cutting their costs when you're asking them to do more than ever in the setting of COVID, you're not really giving them a lot of good faith that you care about them. And then once people feel that way, then they take on the employee mentality, right? Which is what I think is really sad because I think physicians and nurses, it's a calling to go into medicine. It really is, right? Like you love what you do, you love your patients, and you really believe in the heart of patient care. And so when you take away that sense of this is my calling and I'm just an employee, if that's how you make me feel as an administrator, like I'm just somebody replaceable, I'm a cog in the wheel, I'm an employee, well then I'm gonna start acting like an employee and I'm not gonna step up when I need to step up.
Sorry to interrupt you, but no. You touch on such a strong sort of moment because I think that exists in every profession. I certainly have experienced that in entertainment where if you burn out, where burnout is a real thing also. And I think across every industry, no matter what, if you're an Amazon delivery driver, if you're you work at a grocery store, if you're in big tech and you work in San Francisco and you make gazillion dollars, there's still the element of if you don't feel like a part of the process, if you just feel like an employee and you don't feel like you matter, then you lose your whole mojo. I mean, who cares? Yeah. If there has to be a collaboration in everything you do in every career field. People have to feel empowered. We have to know that we are a part of the process. I mean, it's like not to jump out of healthcare, but even you take racial injustice, it's like police work for us. We pay taxes. They work for us. When did it flip to we play by their rules? Their rules are bop, 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 and that's it. That's the end of the story. We have no say. We don't get to be a part of the process. We don't get to judge what they do, how they do it, whether they were justified or not.
The God complex. You give people a God complex when you do that.
It's just good business, right? If for anybody who runs any type of business, it's just good business to include your workers, make them feel empowered, and make them feel a part of the process. Monique, what do you do for yourself? I know you do a lot of extra things like boost your spirits, and I don't think enough can be said about physical activity. And I know Sheena cares so much about what she eats and puts into her body. And what are the little things that we can do to just pamper ourselves every day and say, maybe they're not making time for me, but I'm making time for myself and giving myself a hug.
Thank you for asking that and for doing the bop, bop, bop. Okay, so I want to speak from a realistic perspective right now because I worked bedside for 8 years. So one of the ways that I absolutely, because I never feel like I burnt out, to be fully transparent. Like I never really feel like I burnt out. So, you know.
Congratulations.
Thank you.
That's an accomplishment.
Thank you. For me, it was really, really important to look at each of my patients as being human. And like, I always visualize them being my dad or my brother or like my aunt or my uncle. I had an issue with my last. I've been away from the bedside for 1.5 years, and I'm very happy with my life right now. But my last deciding factor was that I had a quadriplegic patient who was African American. He was 50-something years old, and at the institution I was working at, he came in at the middle of the night, and we needed to do a debridement at the bedside. The physician came up to me. It was a private facility. They came up to me and were like, I need 4 of morphine, and we need to do this now, the debridement. And I was like, I'm really not sure if we should do this at the bedside. I think we should possibly take him to OR tomorrow. Blood pressure's really low. He had a really stressful day. And she was like, I know what I'm doing. This is on my list. Let's do it now. The family's at the bedside. I have worked really, really hard to establish trust with this patient. The physician comes in and says, can you move your legs for me? And the patient was quadriplegic for over.
Was the physician white?
Yes. And the first conversation that we had around this was that after I gave the doctor the chart, and the family was really concerned, but the doctor before going in the room was like, this patient's a frequent flyer, which of course the patient comes into the hospital a lot. They're in a nursing home, they're quadriplegic, so they have pressure ulcers all over, and our job was to do the debridement. And she came in and said, I understand that it's late at night, but this is on my list of things that I was ordered to do, and I need to do it tonight, in front of the family. So that was kind of my cutoff point, because I went to management and I said, this is unacceptable for a physician to behave this way. This is not competent care. This is not acceptable. I established trust with this patient, and I'm really not okay with this. So, went up the chain of commands, and I got written up for being insubordinate in my behavior. And for me, that was my last straw. For that institution. And I do think it is very important for healthcare providers, when they feel unheard, when they feel disrespected, and when their patient population feels disrespected and they feel like they're not walking in their truth at their current role, that they leave. I'm very adamant about walking out of rooms that do not serve you and do not serve your community. So I think the first thing to do is to stand in your power and understand that as a physician, as a nurse, that you are the most employable person on the planet, especially with your
Hello, where's the collection plate?
So, but some of the ways that I was able to be empowered during my career, and I'm still not opposed at all to going back to bedside, because I love patient care. I actually love giving bed baths, and I put wrap my patient's hair up, because you're not going to get your hair all nappy in the bed with me. You're going to have a silk bonnet on. If you're going to be okay, because I really love my patient care. So in order to sustain that love for my work that I feel like my patients deserve, I had to take breaks. A lot of breaks. And I know that, Nisha, you can help with that around financial literacy, because a lot of us are working to live, right? So for me, it was really important, especially as a woman of color, to be financially empowered, to save my money, to invest my money, to be smart about my money. So that's number one, is like to be empowered mentally and financially. When we feel strong in our bodies, also, we feel strong enough to make decisions and to stand up for ourselves. So I definitely think it's really, really important to develop a practice of exercise. I don't care if you hit the air, punch the air, but for me, my yoga practice was really helpful when getting off work. I'm not going to be too long about this, but developing a morning or pre-shift routine and a way to close out your shift routine is very, very important because it says that this time is mine. So for me, I don't like to work in the morning. I don't like to be up early. I was always a night shift nurse. But when I got up in the morning, the first thing that I would do is not, and I recommend this for all of my clients, is check in with yourself before checking in with the world, especially right now. We don't know when we get on social media if we're going to see someone being murdered that looks like us or a cute picture of a cat. Like, we just don't know. So instead of exposing ourselves to that, check in with yourself, write in your journal, write some affirmations or say something aloud that makes you feel good, sing some Beyonce, whatever it is, check in with yourself before checking into the world. So I always recommend that you reserve yourself at least 20 minutes in the morning or 20 minutes pre-shift to just be by yourself. A lot of my clients were unable to find that time, so I recommend them listening to something really ratchet or really peaceful in the car on their way to work. So it's key because we can't control what we experience at work, but we can control how we start our day and how we close out our day. So,
Monique, excuse me, do you meditate?
Okay, so I'm gonna be honest, y'all. I meditate and I guide meditations. I do sound baths, all these cool things, but sometimes I have a really hard time sitting because I'm a busybody. I like to be moving around. So I like to meditate while I'm doing the dishes. I know that sounds crazy, but any action where I can be fully present and be in a state of gratitude, like that is considered meditation. A lot of people meditate while they're in the shower. I like to listen to guided meditations, even if I'm doing something else, to positively brainwash myself. Because when I get online, everybody's telling me I'm not good enough, I'm not skinny enough, I'm not this enough, I'm not successful enough, I'm not working hard enough. And I like to just fill my thoughts more with positive things that remind me that I am worthy, that I am lovable, that I do deserve to take a break. So that's really important to me. But when I was working, it was really, really important. And even now, because my work requires now for me to be emotionally available and not so much physically available. So it's really important that I check in with myself before checking in the world. For healthcare providers, before going home, I really recommend doing some type of ritual that closes out your day. I used to take off my scrubs and give everyone in my neighborhood a free show because I didn't want to bring my scrubs into my house. And I didn't care. I mean, I just was like, whatever. And they would be like, there's Monique getting naked again in the apartment. But it's really important that I didn't bring I'm not a germaphobe at all, but I didn't want to bring my scrubs into my home because to me, that was like, I didn't know if I was bagging up a patient's body that day or consoling a family or running a code, and that energy alone didn't need to come in my home. And I would also like sage myself before coming in my house, which is just a ritual that I would do to kind of clear out the day. For healthcare providers, it's so important that we do the things that we need to do to fill ourselves up because our job, we already spoke about that. Like our management, we can't hold them accountable all the time for doing that for us. So it's really important that we do the things that we need to do to feel empowered. And then we can be strong enough to say, you know what, this job doesn't serve me. You know what, hey, y'all, let's get together and call a staff meeting around this. And we're able to be empowered in that way because we're showing that compassion and empathy for ourselves. So that's kind of the things that I do and I recommend that my clients do to stay really happy in the work field and still have that empathy for others, because when we do look for someone else to give that to us, we're always disappointed because it's never in the way that we really need it. So what I would do with my clients is I call it kind of a save me list, where they write down a list of things that they can do before going to work, or when they feel themselves about to snap, putting it on a small card and clipping it to their badge so that they can remind themselves that they need to walk away before having those explosive moments, and just reminding to fill themselves up. So those are just some of my key things. But when I was working, I really believe the reason I didn't burn out was because like my self-care was so important to me. And it was so important to me that I ended up leaving work because I was like, if I don't leave, I'm gonna end up being mean to a patient, and nobody deserves that energy. So I need to do this before I have some type of incidents that's not healthy. And I ended up taking off for a year and traveling all over the world. And I ended up realizing that my work to heal other people was not meant to be in the hospital. And I'm not sure if it will be again, but at least I'll be able to go back from a space of love and compassion instead of a space of, I got to be here to get my paycheck.
You know, Mo, sorry, go ahead, Ellen.
Sorry. One thing that comes to mind when you just said that was you have an incredible amount of self-awareness. And I think that that's not only a gift to be gifted with that naturally, but I think that that's something we can talk about getting better at, right? Having a sense of awareness, self-awareness, because we know the human beings are very aware of clocking what everybody else does, right? We're really all very good at that. Everybody is very good at checking what you're doing and what you're doing and commenting on that. But I think if we really, as a practice self-awareness, check in with ourselves. How are we feeling? What do we think about this person? Why do we think that about this person? How can we lead with love? How can we check ourselves and make sure we are moving in a way that sets an example for other people to move? Because I know there's a lot of defensiveness, right? And I'm sure with nurses, you know, there's cliques and people get very, very defensive. And how do we check ourselves to make sure that our energy, not that it's our job to teach other people how to be, but for self-care, if we're going to check ourselves and lead with love and try to show by example that defensiveness isn't productive, it doesn't help you, it doesn't help me. So I just think that, you know, I just thought of that while you were speaking, was you seem to just be so self-aware. And I think that that's just worth its weight in gold. And if you're a person who doesn't think you're self-aware, I think not enough attention can be paid to growing your sense of self-awareness, whether that's books on tape, whatever it is. A sense of self-awareness in clocking how we're moving through our day and how we're treating other people. And are we listening, or are we just saying that's not true, that's not real, that's made up? Yeah. No, let's just listen. And, you know, would people be spending so much time talking about something if it weren't real?
Right. You know, I just feel as though we also have to, like, just like you said, create self-awareness, but creating self-awareness is checking yourself, but also checking into how worthy you are. Mm-hmm. Because the problem is that as nurses, I can't always speak for physicians, but as nurses, I know that as soon as we speak up, we're deemed as negative. We're deemed as making...
I will attest to that as physicians as well.
We're deemed as making the workplace uncomfortable. They make it, a lot of healthcare administration makes it seem like they have an open door policy to talk about some of these issues in hospitals. But then when you bring it up, now you're looked at for, and they might not tell you, but you know that those higher ups know your name now, and they know your name for a negative reason. And it comes along with nurses too. I advocate at any institution that I've ever worked in, and this is why I always get deemed as the negative, because I always advocate for, sis, stand in your power. We are the hospital. We make up what the hospital is. They should appreciate us. That's what it comes along with. And it doesn't mean that we can't appreciate them back. But it doesn't mean that we should be walking or tiptoeing on eggshells when we feel uncomfortable or when we feel like this situation isn't serving us. Money is not always how you're going to appease people. It also is by the little things that can be done to make sure that people feel appreciated and celebrated, and that you're concerned with our well-being. And that, I feel like, is the issue. And I always try to say, we are a nurse squad. It's us together, then everybody else. So we have to stick together. If one nurse speaks up and she has an issue with something, if you have that same issue, you come behind her so that change can be made. If one nurse says, okay, like Mo said, I want block scheduling. If you want the same thing, sis, speak up, because one nurse is looked at as negative, but if half the floor says it, they can't deem everybody as negative Nancy's or as the problem child. So if you feel the same way, stand behind them. one person can be villainized, but a whole squad of people cannot. A lot of times nurses feel the same way as other nurses, but they're scared to speak up. These hospitals and administrations are not a dictatorship. You should not be that scared for your job. That goes along with Mo as far as saying financial literacy. And Nishi said the same thing, having financial literacy and having stability so that if a job doesn't serve you, you can get peace. I'm out. Because my thing is, the problem is so many nurses, and I'm assuming some doctors too, live to work. So a lot of times you don't have the amount of financial stability to say, chuck the deuces if things don't work out for you, if things aren't serving you, but it's absolutely necessary. I've seen nurses go out on FMLA from breaking bones, arthritis, terrible, terrible things that you would think would be so preventable with a nurse and with a position, and we're supposed to be taking care of ourselves, but our position doesn't always allow us to do that. And we need to be able to say, excuse me, this isn't right, and this is how we feel it should go. Hospital administration needs to be open to that, and it shouldn't be treated as like, you're the higher up and I'm the nurse down here. No, it should be flipped. We should be the ones telling you how to work the hospital because we're the ones that actually work it. I'm sorry.
Boots on the ground every day.
Yeah, and just one more thing. I think that hospitals miss the mark of thinking that everything is financial. They think every way to appease people is financial. It's not always financial. For instance, a lot of institutions, they did not give anything for Nurses Week. They did not give everybody their yearly raises over the summer. They did not reference nurses they did not give hazard pay. There's a lot of institutions that are not giving workman's comp, even if you're positive for COVID. They're claiming that because you don't know where you got it from, they're not giving you workman's comp. COVID is a disease that lasts a long time for some people. So some nurses are out for over a month and don't know how to feed their families because they've exhausted all of their benefits and their PTO, but the hospital won't give them workman's comp. So yes, there is a financial aspect, but there are other things that could be done. Like I said, as far as like creating an hour for people, for nurses to sleep, figuring out something as far as childcare, being supportive, or how about just not calling our phone about dumb things that don't have anything to do with the job.
Night shift.
Exactly. My thing is that we get all these emails with our higher ups and things like that saying, we care about you and Black lives do matter and nurses matter and all of these things. But then we get the micromanagement on the back end about things that are just completely non-relevant to the C. diff patient when I was knee deep in poop all last night. I don't want to talk to you. I want to talk about my job. So when it comes down to it, hospitals need to also realize that there's more than just money. You can also find ways to support us as actually caring about us as human beings and realizing that we are the integral part of this hospital. We are the stability. We are the standard. So the more that you feed us and cater to us and make sure that we're happy, the more that we will make your patient satisfaction scores go up. Help us help you. It's that simple. Help us help you.
Oh, sorry.
Go ahead.
It was around the self-awareness. So Sheena, thank you for that. Like, I 1000% agree, but the self-awareness, Meredith, you gave, called you Meredith. Oh my gosh.
It's okay.
Watching too much Grey's Anatomy. But Ellen, you gave me a beautiful compliment of saying that you're very self-aware. And I want to just take a moment to talk about self-awareness just really quick.
Yeah.
Because hospitals assume that only nurses and physicians care about money and pay raises and things like that to make our job easier. And that is, I hate to say this, but 90% of my clients that come to me, they're like, I would like my job if I made more money. And then I start to do a self-assessment with them and like ask them about their ideal lifestyle. And it turns out that normally money won't fix anything. So I think as care providers, we have to sit with ourselves and say, priority-wise, what is the most important thing to me? Like, is it being with my kids? Is it being with my family? And that way we can go to administration with the fixes that we actually need and voice that to them. Because it's really key, because, you know, money isn't going to fix the fact that I need a nap at 4 a.m.
Yes.
You know what I mean? It's not going to fix that. So and either is climbing the ladder and getting an award or getting a daisy or a free Chipotle meal that I don't even eat. You know, those things aren't going to fix anything. So we have to check in with ourselves and say, okay, what would make my job better and make me actually enjoy this job? And then we can go to management with this and they can help possibly find solutions. But we often deem that as something that isn't even attainable for us, but we don't even try and explore, okay, for self, what do I need to not burn out? Like, what do I actually need? And then we can start to provide that in our actual lives. And we don't have to teach someone how to treat us, but we can show them how to treat us through how we treat ourselves.
Right. And if administration had an open door for that, and if nurses felt more comfortable to do that, it would be so much easier for nurses to assess, doctors to assess what they need. But when you feel like if you even open your mouth to say anything, it's considered negative or deviant in some way, then of course you're not going to rally behind other nurses. You're not going to do that because it's considered that, when it's like, no, I love my job. I love my patients. It's very therapeutic for me to take care of people. It always has been in my life. So I don't desire another job. I desire a job that cares about me.
Yes.
And I think that's so, sorry, Nisha, that's exactly the point. Is there's no I in team. And if you have to be the only one to speak up, if you don't feel like, everyone should remember, if Sheena is the one speaking up now, you might want to speak up next week, and you might not have the guts to speak up.
Don't call me. Don't call me.
You stood up with Sheena on that day when she stood up. If you stood beside her or behind her, wherever you want to stand, but stand with her, then maybe Sheena's going to be with you when you want to speak up the next time. So I think it's really important for nurses to understand that you have to stand together. You cannot let her or him stand out there on an island and air their grievances by themselves. You must stand with them, because next week it might be you who needs someone to stand with you.
Right.
That, it's so important to try to have this attitude of we are one team. And then the second piece I want to say is, listen, all these administrative problems, we have to approach them, as if I'm really in healthcare. We approach,
You probably know more about healthcare than 90% of the population, 95.
These administrative issues, the same way we're approaching them in the entertainment industry, which is, we have to have more people in administrative positions of power. We have to have more women and more Black women and more people of color, more women of color in positions of power in these hospitals as hospital owners and hospital administrators. Otherwise, nothing is ever going to change. It's the same in Hollywood. As long as you keep the people of color or the Black women down at the bottom and there's no opportunity for executives in power that look like you, things will never change.